Welcome to our discussion on radiation treatment management. I'm Mrs. J. Let's get started. All right. In order to understand radiation treatment management, what is it? Well, let's define what radiation treatment is, and that's pretty much um, the delivery of radiation to a patient, typically when they have cancer. So they just don't go in and do these radiation treatments. No, there are stages to that process. However, the stage that we want to talk about is radiation treatment management because it has the most nuances when coding. So let's get into it. What is radiation treatment management? Well, essentially, it involves the oversight of the radiation treatment, right? So it involves ongoing oversight and coordination of the patient's radiation therapy course. So this is not a single service. No, it's a bundled and comprehensive service that includes reviewing the patient's condition and response to radiation treatment, monitoring dosimetry. And dosimetry is the radiation dose measurement and planning. And they also monitor the dose delivery and treatment setup and examining and evaluating the patient and making necessary modifications to the treatment plan. So they ensure that the patient is safe during the radiation process. And yes, this radiation treatment management is not the delivery of the radiation. Again, this is the management. So, why is it in the radiation section? Why is it in the radiology section? That is a good question, but radiation treatment management codes act like professional components. Act like they are professional components, and these are the common codes 77427. This is the code with the nuances. It's treatment management 1 through 5 treatments. 77431. This is treatment management 1 to 2 fractions. 77432. This is SRS management cranial lesions. So the treatment is directed at cranial lesions in 77435, SBRT management, and that's stereotactic body radiation therapy. So these are your codes, but it is the 77427 that we're going to really hone in on. All right, so in your CPT manual, you'll see the radiation management and treatment table. And pretty much, or generally, it shows you how to code. When a patient has 1 to 5 treatment and that provider is coding for the management of it, it is, and look, it's a professional component. Look at that. It's telling you this is like a professional component. They're telling you the code to use, 77427. 77431 if it's 1 to 2 fractions, and 77432 and 35. This is okay. This is okay. And I'm going to show you why this chart is just okay because it doesn't consider the guidelines. Now, if we go to CPT, we go to radiation treatment management, and you read the guidelines specifically in this section, it tells you how to administer these codes, these treatments and fractions. Pretty much, you're going to use 77427 when you have between 3 and 7 treatments. And you might say, Mrs. J, the chart says 1 to 5. The guideline gives some allowances. It says multiple fractions. Let me get my pointer. Multiple fractions representing 2 or more treatments furnished on the same day may be counted separately as long as there is a distinct break in therapy sessions. However, code 77427 is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of the course treatment, right? But 1 or 2 fractions beyond a multiple of 5 at the end of the course treatment are not separately reported. Okay, coders. So essentially, all it's saying is code separately 3 to 7 treatments, 77427. For 1 to 2 treatments, use 77431. And then we give you a little example. If you got 3 treatments, 77427. 9 treatments, 77427 times 2. And if you need me to explain it, it's just basically they're saying, hey, if you deliver a treatment, you deliver 5 treatments, you use 77427. However, if you have to go 1 or 2 fractions beyond that 5 treatments, don't code it separately. It's bundled. So in other words, you can have up to 7 treatments. And that's pretty much it. And coders, it took me a while to understand it. So if you need to, revisit what I'm saying, definitely press rewind. Okay. So what do you do when this chart below is not quite right? This is how I would chun it. Yeah, because you can take this chart with you. 3 to 7 treatments. 77427, 3 to 7 treatments. That's pretty much it. And through practice. If you practice this, you're going to get it. You're going to know it. All right, speaking of practice, let's go ahead and let's solve our first scenario. Okay, coders, I kind of thought about it and I said, man, it probably would be helpful if I created a management treatment chart for you. So if there's 1 treatment, there's your code. 2, there's your code. 3, all the way down to 14. I have the codes written for you. All right, so just put them in your book and let's get started. And also, just go ahead and screenshot. Now, it's time to do our first scenario. And of course, it's going to be a radiation treatment management question. Of the following answers, which best describes the encounter? A, 77373, B, 77427 times 2, 77431, C, 77427, 77431, and D, 77427 times 2. A 68-year-old male patient with localized prostate cancer is undergoing external beam radiation therapy. The provider documents radiation treatment management over a course of 10 fractions, which includes weekly evaluation of the patient's response, review of port films, coordination of care, and assessment of any treatment related side effects. This management is a part of a continuing therapeutic course. Okay, coders, your time begins now. If you need more time, just press pause. Before I get into the inventory, I just want to say, if you can recall, we just learned that when the doctor does his part and it involves managing the patient's treatment, we are going to be coding the radiation treatment management. We will not be coding the delivery. Okay, coders, this is the doctor's part, and this is my inventory. This patient has localized prostate cancer, external beam radiation therapy did take place. However, this documentation supports radiation treatment management. It says, hey, this patient has had 10 fractions, and it includes weekly evaluation of the patient's response, review of those port films, coordination of care, and assessment of any treatment related side effects, right? So we are coding for that management. Now, so what do? We're going to go to the management codes. So I want you to know that these codes, specifically 77427, that's the one with the math in it. So I just want to let you know that these codes are assigned on they're assigned based on multiples of 5. For every multiple of 5, you assign 77427, right? So you can kind of deduce what the answer is right there. Also, the nuance is not the multiple of 5, it's in between those multiples. So if there's 1 to 2 units over that multiple of 5, you don't code it. It's bundled in 77427. And if it's 3 to 4 over a multiple of 5, go ahead and assign 77427. So if you look at this chart, that's exactly what's happening. Multiple of 5, let me get my pointer, you get 77427. But 1 to 2 units over that multiple, so 1 to 2 units, there's 1, it gets bundled. See? No additional units of 77427. Now 2 units over that multiple, which would be 7, it's bundled. See, you don't assign an additional code. However, when you get to 3 to 4 units, 8 would be 3 units over 5, right? 5 plus 3 is 8. You see, you get an additional code. 9 is 4 units over 5. You get another code, right? But we don't have to worry about the multiple of 5s, right? You do assign one unit, one code, 77427 for each multiple of 5. Okay, coders, hopefully that said something to you. But if it doesn't, some people just really don't really get numbers, and I get it. So that's why you can use this chart, right? So we've got 10 fractions, right? Yeah, 10 fractions. There's your answer, 77427. And if you said D, outstanding. And if you need this chart, it is okay, especially if you're taking the exam. It'll give you a little bit of security, right? You don't have to think. You're going to get the answer correct. Now we got to do our due diligence, right? And guidelines drive the answer. Yes, guidelines drive the answer. That chart is guideline driven. Yeah, I considered the guidelines, 1 to 2 over, etc. So it's up to you how you want to chun. This is radiation treatment management. It is 5 treatments. That's what it is. So if you want to put 3 to 7 treatments for each, go right ahead. All right, coders. So, um, it's pretty straightforward now, right? And the answer is D. And if you said D, way to go, way to go, way to go. Now it's time to move on, coders. Let's go ahead and put the cherry on top and secure your understanding of radiation management. All right, we got another scenario. Of the following answers, which best describes the encounter? A, 77427, B, 77427 times 2, C, 77431 times 1, and D, 77427 times 3. A 72-year-old female patient with stage 2 non-small cell lung cancer began a course of external beam radiation therapy. She's completed a total of 9 fractions over 3 weeks. The provider documented weekly treatment management, including review of port films, coordination of care with the oncology team, and evaluation of treatment related fatigue and mild skin erythema. Okay, coders, your time begins now. Remember, if you need more time, just press pause. All right, coders, how did you do? I know you knocked this out of the park, especially if you've used the chart to solve the scenario. And that's what we're going to do. Yeah. All right, so here are my key words. We have stage 2, non-small cell lung cancer, external beam radiation therapy, radiation treatment management with 9 fractions. And remember, fractions and treatments are used synonymously. Then at the end, during the management session, they indicated that this patient suffered from fatigue and erythema. So I know I said it different, right? So it's erythema or erythema. You know what? They're both correct. All right. There's no one way to say it as long as you're saying it phonetically correct. So sometimes I say it both ways, just, kind of to relate. All right, coders. So here's our chart, right? And what do? We look for our 9 fractions or our 9 treatments, and it says the code is 77427 times 2. Yes, 774 times 2. And if you said B, way to go, way to go, way to go. Now, coders, I know sometimes I beat a dead horse. I'm not trying to do that. No, but I'm trying to say it differently so you get it. I'm not saying more, I'm saying the same thing differently. All right, coders. So this is the last thing that I have to say, and it's a gem, right? So if this resonates with you, count by 5. 1 and 2 more you got to hide. 3 and 4 earns you more. And it kind of rhymes. And I'm going to use my little pointer. Count by 5. 1, 2, 3, 4, 5. 1 and 2, 1 and 2, you hide these. You don't code these additionally. But if 3 and 4 beyond, 1, 2, 3, 4, that earned you 1 more code. So count by 5, always count by 5. If you have to go 1 or 2 steps, hide, no code. 3 or 4 more steps, that earns you more. You have to code another one. Okay, if it resonates with you, outstanding. I've done my part. And I think you got it. But if you want a better version of the chart, here it is. Go ahead and screenshot. And this completes our presentation on coding radiation treatment management. I hope you found this discussion helpful. If so, please like and comment and below. And don't forget to share. Okay, coders, until next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.